Good Saturday morning to everybody, and welcome to HyperFit MD radio show, where we talk about age management. HyperFit MD, Age Management Center, located down in Milford. Joined, as always, by Dr. Charles and Francesca Guglin. I'm Gary Byron. Hey, gang, how are you this morning?
Really good.
We're good.
It's great to see you.
Yeah. Feels like we never left.
Right? How was your week?
It's been good. It's been we're busy. We're
good.
We made that. We're a new business. We've been
what's new?
5.5 years.
How long have you been around? 5.5 years.
5.5, 6 years or so, and we've made that transition to being busy enough at this point. So we're thinking about adding another physician or adding maybe a nurse practitioner to the practice.
Oh, wow.
We just got to wait for our taxes to come back. We'll
Sure.
see.
Good luck with that.
Yeah, right. Uncle Sam will tell us whether or not we can.
Last week, we did something kind of unique. I don't do too often, but I felt it was necessary for this particular show, only because the audience of this show has grown over probably the last couple of months, as opposed to, anytime you try to ramp up in the beginning, it can be a little difficult. But now I know I'm talking to people outside in my personal life, and they say they just tuned this show in, and they've missed some of the topics that we had discussed a while back, including perhaps an overview of what exactly HyperFit MD is, your background. I know you went into a little bit before. I've got a continuation from last week's show that I'd like to pick up at. But before I do that,
sure,
I just kind of want, if you can, in a minute, 2 minutes tops, just a quick synopsis to bring people up to date here. What it is that you do, your background, a small version of how you explained that last week.
Okay, 500 words or less. I was a surgeon in Southern Connecticut for 35 years or so, and started looking at a career change. Basically, I did it for 35 years. I turned 60, wanted to slow down. Piece of advice: if you want to slow down, don't start a business. How's that? And started looking into functional medicine, age management medicine, going to conferences and things like that, and understanding in a fundamental way that this is really the approach to medicine that we should be taking, in the sense of helping people figure out where their baseline is from a metabolic and a physical standpoint, and then help them work on improving their quality of life by improving their health. So that's basically what we do.
Okay.
We do a lot of, we see a lot of andropausal and postmenopausal men and women. We see a lot of people with functional problems, and help them through those changes in life that occur that in the sort of regular medical fields are considered normal for a person to go through, let's say, estrogen withdrawal, and then very slowly become osteopenic, turn into an apple, have no libido and no intimacy left in their lives because they're not interested in it anymore, not able to exercise or do any kind of exercise because of osteopenia and sarcopenia, which is muscle mass. One of the things we talk about a lot in our practice, we talk about osteopenia all the time, but we don't talk about sarcopenia. We lose about 10% of our muscle mass every 8 years post-menopause and post-andropause. So what we do is help usher people into a healthy quality of life as they get older, and make them understand in a fundamental way that if they just do some of the work, we can help them maintain a quality of life into old age.
I know you're an MD, and you have quite an extensive background there. If I remember the term that you used just last week, you've got like 1 foot in homeopath, 1 foot in naturopath. You look at alternative medicines. I mean,
sure.
I remember you saying just a week ago that you'd consider sending somebody to a chiropractor,
sure,
or somebody that does acupuncture, or things like that. So you will look, or we mentioned witch doctors and spiritualists and so on and so forth. You will look at the entire healing process as a whole, not
right,
just through being an MD.
Right.
What's
Whatever
best
works
for the patient?
Well, right, and
Whatever
it could be
works.
many different avenues. It could be medical. It could be an MD in one aspect of one of their issues, and it could be naturopath, or it could be anything. Right,
Right.
Not just allopathic. It could be any it could be any one of the
Exactly.
type of.
If you come to me with blood work that looks like your bone marrow is failing, I'm going to send you to a hematologist. If you come to me with bad back pain and no one's been able to help you, I have a cluster of really good chiropractors I'll introduce you to. So a lot of it has to do with what your problems are. We'll find the right person for you.
All right. So let's continue. And I know that you work with hormones.
Yeah.
So how does that work in your practice specifically then?
It's basically age management started with hormone replacement therapy. We look to the person who is getting older between 40 and 60, going through menopause, andropause. Menopause is basically ovarian failure. You stop making estrogen, you stop ovulating. Once you stop ovulating, progesterone is no longer part of your life. And as women get older, the levels of testosterone in their blood tend to drop off too. Women need testosterone. Women go through menopause in a year or two, so they feel the symptoms acutely. And we all know what those symptoms are. We've talked about it before. Men go through andropause, which is basically testicular failure, over a period of years, 10, 12 years. So we don't feel those symptoms acutely. We just get kind of old, fat, and crabby, And so it's the same thing, and it's basically hormonal withdrawal. And the science has been done about this stuff. It's clearly beneficial to your overall health. It's cardioprotective. It protects cognitive function. It maintains, like we talked about, muscle mass, bone mineral density, all of those things. Intimacy does not leave your life because, once a woman goes through menopause, what happens? They suffer from vaginal atrophy. They start to have pain with intercourse, so it becomes painful. Their libido drops off. So intimacy drops out of a marriage during those years as well. And if you're just satisfied with hand holding and taking walks in the park, that's one thing. But when that happens frequently, people they part ways, live in the same home, but they part ways. And so hormone replacement therapy is baseline key to maintaining most of the aspects of health into old age. And the science has been done about this stuff. It's taking testosterone does not give you prostate cancer. A balanced hormone replacement program in women does not put them at greater risk for breast cancer.
Those are serious myths, though, because this is not my wheelhouse. This is not an area that I'm an expert in any way, shape, or form. But I've even heard that.
Yeah.
Because there's synthetic hormones and there's bioidentical hormones.
Yeah.
So maybe you want to elaborate.
Well, two things. There's many myths around because of really super, super bad science that's been done about this stuff in the 90s and early 2000s. That's a whole nother 2 or 3 shows together. One of these days we're going to talk about the Women's Health Initiative, which is a very specific scientific study that was done by paid for by the federal government that started this business. But like Francesca said, one of the things about that study is that they use synthetic hormones. They use Premarin and Provera. Premarin is what's called a conjugated equine estrogen. It is literally an estrogen that's made from horse urine. And only a very small component of Premarin is actually bioidentical human estrogen. Most of it is horse estrogens. They used Provera, which is not a progesterone. It is a progestin. Every single cell in the female body has receptors for progesterone. But the only part of the female body that has receptors for progestins is the uterus, because of the myth that has been in gynecology forever that a woman does not need progesterone if they don't have a uterus. Because don't forget, when we were kids, every single mom in the neighborhood had already had a hysterectomy, okay? So when those women went through menopause, most of them were surgically put through menopause, and nobody did anything for them. But so the myth was that back in those days, the party line was that if you didn't have a uterus, you didn't need progesterone. So these women were then placed on Premarin, which is a conjugated equine estrogen, is not balanced by progesterone. And so, of course, they started having increased levels of stroke, increased incidence of breast cancer, so on and so forth, because of the way things were done back then. And then really, really bad science put a whole layer of myth over the whole thing. but that's a whole nother several radio shows.
No, I know we should definitely dedicate some time.
Yeah.
Maybe a whole show just specifically on that. Now, so besides blood work, what other kinds of testing do you guys do?
We do a lot of body comp analysis. We do DEXA scanning. This is all part of the introduction to the practice, by the way. We do DEXA scanning. Most hospitals have a DEXA scanner, which tells us your bone mineral density. But the DEXA scan that we use gives us your lean body mass. We see a lot of bodybuilders and a lot of athletes for the stuff that I'm about to talk about now. Gives us your lean body mass, and gives us and this is, by the way, the gold standard, within 2% margin of error, your body fat content. And from my side of the practice, the functional medicine side of the practice, it breaks up that fat into two categories. Gynoid fat, which is that outside fat, the stuff that makes your pants not fit.
Right.
And visceral fat, that fat that encases our organs inside the belly. That fat is metabolically active. It's a principal cause of insulin resistance, which is the principal cause of the diabetes epidemic in this country. It's one of the causes of metabolic syndrome, hypertension, diabetes, cardiovascular events, stroke, so on and so forth. And so on the functional medicine side of the practice, much of it is about belly fat and trimming belly fat. We do VO2 max studies. If you've seen an image of an athlete running on a treadmill with a mask on their face, EKG leads, what they're having done is a VO2 max study. That gives us an enormous amount of information about your overall fitness level. It gives us an enormous amount of information about your lung function under stress, your cardiac function under stress, and it tells us a very important single piece of data, which is your anaerobic threshold. Your anaerobic threshold is the heart rate at which you go from functioning aerobically to anaerobically, because many of our patients are on high-intensity interval training programs, and we want to know what the anaerobic threshold is because we want them training beyond that anaerobic threshold. And then we do resting metabolic rate. Go ahead.
No, please, no.
And we do resting metabolic rate, which is an easy one. You got to run on a treadmill for 8 minutes. That's no fun. But
it's a great test.
Yeah,
like a stress test.
Yeah, every time we calibrate the machine, Francesca's our guinea pig. We got more data on her.
No, but at least you know. First of all, you know where you're at and where you can go, because we can all improve on our fitness. So no, it was cool. I haven't been running on a regular basis because I had got COVID and my lungs were a little damaged. But now I'm getting back into it, and considering I haven't really run this year, I'm still in the good category of fitness. So, for my age.
We spoke last week about when a client comes, or a patient or client, they come to visit you, and there's some general questions that you will ask. Mm-hmm. But I'm not even going to ask what people are seeking. We covered some of the more popular ones. Issues last week, and it could be a myriad of things. It's probably too complex to even get into. But I will ask you this. What can someone expect when they walk through your doors? They make an appointment. I'm going to go over your contact information momentarily. Mm-hmm. But when they walk through your doors and they meet you, and let's say it's the initial consultation, which in the past you said it's free, right? Mm-hmm. What can they expect?
They're very surprised.
Well, I don't want to give away surprises. I mean, it's like the ending of a
there's a clown there with balloon animals.
The cliffhanger of a motion picture. I don't want you to give away the secret sauce.
No, I think people.
But generally speaking,
people they can't believe. One, the consultation, and one going through the process. Yeah. How comprehensive it is, and the knowledge that they get.
I don't mean to interrupt, but first of all, they're greeted by a pretty woman who's smiling at them and asks them what she can do for them. What do you usually see when you walk into a doctor's office? I call it the FU window. The FU window, that when you walk through the door and she very in front of you closes that window and makes believe that she hasn't seen you come through the door for a couple of minutes, just to basically put you in your place or whatever. And then she'll open up the window and she'll ask for your card and all that other stuff like that. That's not the way the practice works at all. They're greeted by a person who already knows their name. Wow. We used to have this chalkboard, and we would the people who are coming in for the day, we would say welcome, and they would put their name. But then a couple people complained and said, I don't want anybody to know that. So we stopped doing that. So they're welcomed by Francesca, and then the first time around, they sit down with me We sit down knee to knee, in an office that's covered with paperwork. Clear spot in the paperwork for to sit down. And like we talked about last week, I'll just say, what's going on? Why are you here? And then I just listen. And typically that first consultation takes, half an hour, somewhere in there like that. Basically get some idea, quite frankly, as to whether or not they think that we're a good fit, and whether or not I think that we're a good fit for them. Okay? I mean, occasionally I'll send a person away, especially somebody who is spending money in our practice and getting nowhere because they're doing nothing. Okay? I'll say to them, look, man, you spend a lot of money in this practice, but you're not getting anywhere because you're not doing anything, Just replacing your testosterone or just getting you on supplements is not going to get you where you want to go. If you're still drinking 8 stouts a night, on your boat every night, and calling in for pizza 3 nights a week and things like that, you're just not going to achieve your goals. So we will be here when you're ready, okay? Mm-hmm. But you're not ready right now. So a lot of it has to do with determining whether or not they think we're a good fit for them.
Okay.
Yeah.
That makes sense. I know recently we talked about IV therapy. It's something that you do regularly. I know you've learned about it. I've just learned about it recently. So you do that, right?
Mm-hmm.
Okay.
Yeah. We have a pretty busy IV therapy program. We see a whole range. We see a lot of cancer patients. We see patients who are they're on chemotherapy, they're being treated, but they're under the weather because they're sick. They come in for nutrients and hydration and things like that. We see a lot of hungover guys in the practice, Fridays and Saturdays. We have a very special one. If you go to the emergency room, alcohol toxic, the same IV that they give you there, we provide the same thing, which basically cures your nausea, a very strong anti-inflammatory for the aches and pains, and then a lot of fluid with nutrients, B vitamins, so on and so forth. During flu season, we do a lot of IVs of what we call the natural defense. So basically, they're nutrients and a lot of hydration. I mean, this is something that anybody who's gone to Vegas and overserved themselves knows that there's an IV. There's trucks in Vegas that do it for people. We do NAD. That's another whole show.
NAD.
Yeah, NAD. Yeah. We've been offering NAD therapy in our practice for 6 years. Now there's been a couple of books written about it. Now everybody wants it. So we're doing a lot of NAD therapy in the practice now as well. For a while, we just had sort of a stable of nurses that work full-time elsewhere. And so we would call them when we had somebody coming in for an IV. But now we have a nurse there pretty much full-time. So we can do it with a phone call. You don't need to make a reservation or anything like that. So yeah,
very nice.
It's become a busy part of the practice.
Folks, you are listening to HyperFit MD radio show, where we always discuss age management. You can actually visit HyperFit MD Age Management Center. They're located down in Milford on Noble Avenue. Very easy to get to. You can give them a call as well at area code 203-890-9777. Again, 203-890-9777. And online at www.hyperfitmd.com. Again, hyperfitmd.com, along with Dr. Charles and Francesca Guglin. I'm Gary Byron. So you've talked briefly in the past about regenerative medicine. Just remind us, what is that exactly?
Well, let me use a very specific example. You've got a bad knee. It's been a bad knee ever since you played baseball in college, let's say, okay?
Yep.
That knee is just getting arthritic, worse and worse. You've had an x-ray that shows that you've got bone on bone in that knee. The cartilage is gone. But the orthopod that you saw says, in good faith, he says, look, man, I have an operation that's going to fix your problem. It's a knee replacement. But why don't you just hang in there until you absolutely have to have this done? Because it has a finite lifespan, a knee replacement. And you may, if you get it too early, you may need another operation 15, 20 years down the road. Regenerative therapy, those people are in the sweet spot for regenerative therapy. Because what do they have? Your knee has, basically, it's chronically inflamed. Your immune system is not doing much. Your immune system is desperately trying to heal it. but the damage is crossed over with your ability to heal it because all you got going there is chronic inflammation. If I take your platelets, if I spin them down and take 60 cc's of your blood and spin it down and get 6 cc's of pure platelets, or I procure from a qualified company fetal stem cells and put those in your knee, what that does is basically stem cells and PRP, or platelet-rich plasma, do the same thing. They initiate the acute phase of healing, which then starts the 3 phases of healing. The first phase is inflammation, where all those entities send what are called cytokines, or chemical messengers, into your bloodstream and call all of the healing cells in your own immune system. You know, your own stem cells, your own white cells to come and clean up garbage in that knee. Then fibroblasts, which lay down collagen. And then the third stage of healing is always neovascularization, or new blood supply. So now you're supplying new blood, new collagen. Your immune system now is paying attention to this knee, and it's starting to heal the knee, and you start to feel better. It's not a quick fix. When somebody puts cortisone with lidocaine into that knee, you walk out of the office feeling better, but that cortisone is ultimately destructive to the joint, which is why a doctor will only tell you you can only have 2 cortisone shots because the third one's going to start eating up
A year, right? Or ever?
Well, for me, it would be forever. A lot of times they'll say in a year. Cortisone is destructive. It's baseline destructive, and it completely switches off the healing mechanism in that knee. What this does, it creates a healing process that takes 4 to 6 weeks. So over 4 to 6 weeks, that knee starts to feel better, and then you're back on it again.
I would imagine that aesthetics, which is quite an umbrella, right?
Right.
Plays big time into age management.
Yeah.
In fact, I'll let you take whatever time that you need if you want to go right to the end of the show, because it's a myriad of things that fall under that umbrella.
Yeah. Well, age management has to do with the inside and the outside.
Yeah.
You know, every single person on the planet, I don't care who you are. A lot of people claim to not be vain, but that is a vanity in and of itself, quite frankly. You know, everybody looks in the mirror and there's one thing that they would change if they possibly could. And as we get older, that list of things gets a little bit longer, you know. So we do aesthetics. We do hair transplant, hair restoration surgery. We do hair restoration. We have a full range of hair restoration. We do Botox, and we do dermal fillers. We're getting into PDO threading, which is a whole other aspect of aesthetics. We do PRP, micro needling facials. We're looking into buying some equipment in the near future that will help with wrinkles and so on and so forth. A lot of these machines cost boatloads
like
of money.
Botox or things like that.
Yeah. Well, yeah, we do Botox. We do dermal fillers, which you've heard of. You know. So yeah, a lot of facial aesthetics, especially. The hair restoration and the rest of the aesthetics in terms of body composition and stuff like that, as far as I'm concerned, that's to a certain level, that's aesthetics also. If your clothes fit better, okay, if you, that cluster of clothing that you've got in the back of your closet, you know, those incentive clothes that you got, the ones with the 34-inch waist, you know.
I'm holding on to them because I'm going to get back to that weight, and I want to be able to have those jeans.
Yeah, that's your incentive pile of clothes.
Yes, that's right.
Yeah, that is a matter of aesthetics as well, man. If you can fit into those pants that you got stored in the back of your closet, how much better are you going to feel about yourself, you know? So,
is that what this is all about? Is this about the better you'll feel about yourself?
Yeah, it's part of it, and better. Well,
how you feel.
And how you feel. Yeah.
Okay, so how you feel,
Yeah.
which is if you're feeling better, but it's not all medical.
No,
it's not all.
No.
Okay,
Jesus, no. It's stress reducing. Look, achieving a goal in your health or achieving your goal in body composition or whatever is extremely motivating. What you've been through this, okay? So you know what it feels like. I mean, not in our practice, but you've been through a weight loss regimen
before I even met you. Just for the record, because
before you even met us,
you really are the real deal, and I don't want to mislead anybody. This is long before I met you, or actually, I met you. I think just a couple of weeks after.
Right, and think about how a little bit of success on that journey you took motivated you towards more success.
And you'll stick to it.
Right.
When you see results, it
Yes.
motivates you. And you're right. The result is that you do stick to it. Right.
Yeah,
I
right.
think what happens is people get disenchanted by going, all right, well, they expect Rome to be built in a week, and I don't see any results out of hell. It
Right.
doesn't work. It's a scam, When the truth of the matter is, no, it's a program. I mean, like any program, you need to stick to it.
Yeah.
Yeah.
Took you a while to get there. It's going to take you a while to get back,
Yeah, but I would imagine a lot of what men are seeking are pretty uniformly, right? Where what one guy seeks is very similar to what another guy, or maybe am I different? Where what one woman seeks could be completely different than what other women seek. Is there any truth in
We're
that?
complex.
Oh, you said that. You said that, I think, last week. Your words, not mine.
Yeah, women are work. But
Are women are they more difficult to diagnose, or are they more difficult to?
they are literally more complex from a metabolic standpoint, from a hormonal standpoint, from the neck up. They are much more complex than men. I hate to be gender specific, but
We give birth.
And that can have something to do.
yeah, there's that too.
That'll offset the.
Yeah. They've suffered the pain
balance.
of childbirth. Yeah, but I've had kidney stones, so as far as I'm concerned, that's equal. Look, there's a cluster of complaints that pretty much everybody has. What are they? Fatigue, weight gain, insomnia, sleep pattern problems,
Loss of interest.
loss of interest in sex or intimacy, so on and so forth.
Behavior?
Usually it's more of a cognitive thing.
Well, because
Brain
it'll
fog.
result in those issues could result in a change in behavior.
Right.
Folks, if you found any of this at least at minimum intriguing, because there's so many other issues that we haven't even touched upon that we will wait for next week in future shows, please contact HyperFit MD. They are located at 88 Noble Avenue, Suite 105 down in Milford, Connecticut. You can check them out online at hyperfitmd.com. Again, it's www.hyperfitmd. You can also email Dr. Charles Guglin. It's pretty easy. It's cguglinmd. That's CGUGLINMD at hyperfitmd.amc.com. And their phone number is area code 203-890-9777. Once again, 203-890-9777. 9777. For Dr. Charles and Francesca Guglin, I'm Gary Byron. Until next week, everybody, have a good one.